A very good morning to one and all present here. So, the only way of discovering the limits of the possible is to venture a little way past them into the impossible. So, very good morning to all the delegates and resource persons of today's online awareness program on pharmacovigilance in Ayush drugs. Ayush systems of medicine have their own pharmacopoeia and their own principles, but they have been practiced as over the counter drugs in the country without any authentic prescription. So, in this era of globalization, considering the growing use of Ayush drugs, a nationwide program has been initiated under the Central Sector Scheme funded by the Ministry of Ayush, New Delhi, for monitoring and developing a system-wise database of adverse drug reactions related with Ayush drugs. Father Muller Homeopathic Medical College, being one of the peripheral pharmacovigilance center in homeopathy, is organizing this awareness program with an aim to provide an insight into observing, reporting, and documenting the adverse drug reactions related with Ayush medicines. Prayer is the recognition of our limitation and our dependence on the Almighty. Let's invoke the blessings of the Almighty through a silent prayer. For today's awareness program on pharmacovigilance in Ayush, we have with us our first resource person, Dr. Girish Keje. Dr. Girish Keje graduated from University of Mysore in 1998 and post-graduation and doctorate from the prestigious Gujarat Ayurveda University, Jamnagar in 2002 and 2007, respectively, in Kaya Chikitsa General Medicine specialty. Currently, Sir is serving as Professor and Vice Principal, Patanjali Ayurveda College, Haridwar from July 2023. He is mentored by Reverend Acharya Bal Krishna Ji, Dr. Prasanna Narasimha Rao, and Dr. Madhav Singh Baghel. Sir has served as a research coordinator and member secretary IEC in SDM College of Ayurveda and Hospital, Hassan, for 6 years. Sir has published several original research papers in national journals. He has specialized in Vajikarana Tantra, that is, management of male infertility and male sexual problems. Other areas of interest are gastrointestinal and rheumatological diseases. Sir has been awarded with the Best Teacher 2011-2022 of SDMC ANH Hassan. He has served as Dean Academics from 20th November 2017 till 30th August 2021. Sir has shouldered responsibility of institution as Dean Program Planning, Implementation, Monitoring and Student Admission from September 2021 till June 2023. Sir is an expert in IT and has prepared digital database for postgraduate thesis of all specialties from Institute for Postgraduate Teaching and Research in Ayurveda, Gujarat Ayurveda University, Jamnagar. Sir is also the co-editor along with Dr. Madhava Singh Megal, former director, IPGT and RA, Jamnagar, for researches in Ayurveda. Sir will now preside over the program with his topic, Introduction to Pharmacovigilance in Ayush Systems. Delegates could post your queries in the chat box, which will be clarified at the end of the session. Over to you, sir.
Uh, Very good morning to uh, one and all present here. Hope I am audible and the audio quality is good. Um, Respected Prabhu Giran sir, the principal, respected Dr. Professor Sugatan, the coordinator of the Pharmacovigilance Center, Peripheral Pharmacovigilance Center at Father Muller Ayurveda College. I need to take in absentia Dr. Galib, who is the person behind this whole program, who is the guiding force behind all this program. He is a professor at All India Institute of Hello. Sorry for the interruption. I joined through mobile. I need to take name of Dr. Galib. So I welcome all the participants from the participants and the peripheral pharmacovigilance coordinators across Ayush systems. Many of you may be already aware. Dr. Saudat, can you just share the PowerPoint if possible? So
Yes, sir.
pharmacovigilance is a science. Pharmacovigilance is a science. So there are several aspects beginning from, you can go to the third slide. Pharmacovigilance is a science. There are several aspects or facets of this science. Specifically, when it comes to Ayush system, certainly there is need. There is a popular belief. Without wasting much of time, within half an hour I'll finish. There is a popular belief that clearly questions the need of pharmacovigilance in vigilance for Ayush system, whether it is ASU or you call it as Ayush, right? Including yoga. Certainly, they are medicines. Whenever there is an effect, certainly there is side effect. Whenever there is an effect, there should be an adverse drug reaction. Whenever there is a adverse drug reaction, there should be an adverse event. So there is no controversy. It is not to contradict the common belief that adverse drug reaction does not happen with Ayurveda or specifically with today's program homeopathy. Certainly, it would happen because anything and everything. If you go to the next slide, anything and everything that goes to the that is consumed in the name of medicine, practiced in the name of medicine or therapeutics. Please go to the next slide. Would have. If you next slide. So in the name of medicine that is practiced and consumed should have. So there is the point we need to remember is about polypharmacy. Patient would be taking modern medicine, Ayurveda, homeopathy, and they will be using traditional medicines. So certainly there is need of pharmacovigilance in Ayush system. Basically, our focus should be not to flatly accept that Ayush medicines are totally safe. Most of you who have practiced, know that adverse drug reaction do happen for Ayurveda. So this slide makes it very clearly that what are the risk of treatment or therapy producing an adverse drug reaction. So pharmacovigilance is a science which deals with uncertainties, ifs and buts. Basically it is to generate a signal, say develop a hypothesis and generate a signal so as to suspect possible adverse drug reaction. It is not to prove, but to generate a signal. What is the potential seriousness and duration of possible harm effect? So when a medicine is taken, when certain practices, maybe non-pharmacological, line of management is followed, we need to suspect what is the seriousness and duration of possible harmful effect. Next slide. Next. Does the patient have any medical or allergic condition which might cause a bad reaction to the drug? So as I was telling, the pharmacovigilance has got several facets. It is not, whatever that I am speaking or today we are going to learn is a primer. Being a pharmacovigilance, coordinator for pharmacovigilance center over at Hassan for more than 10 years, I have come across adverse drug reaction which most of us would disagree to the core. Oh, for this medicine, it cannot happen. For this, next. For this medicine, this adverse drug reaction cannot happen. For example, in Ayurveda, we have something called as Mahanarayana Taila, which is perceived to be the safest. But even for that, patients have developed severe local reaction, which most of us would disagree. Similarly, it may happen with homeopathy also. Those who have practiced, and despite the best of the best or appropriate what do you call appropriate proper diagnosis, proper assessment of the patient, and correct line of management, even with the proper dosage, there is every possibility of adverse drug reaction. It may be person specific, it may be it will be mostly idiosyncratic, but from the science sake, from the science perspective, certainly those side effects, adverse drug reaction, adverse events, most important, no effect. No effect also is a part of pharmacovigilance, dear friends. Next. Any interaction with other things in patient. What we need to understand is about the polypharmacy. Loving the science for sake of loving, that Ayurveda is great for Ayurvedics, homeopathy is great for homeopathics. But from patient perspective, patient has got a choice to consume. Say, for example, the patient may be consuming OHDs and antihypertensive, modern OHDs and antihypertensive for diabetes and hypertension. He may be consuming for, say, mental stress, Ayurvedic medicines. He has the right and the choice to consume medicine for skin condition. So whenever it comes to the polypharmacy, certainly we need to suspect. My humble submission to the audience is that we need to, with an open mind and heart, we need to accept that adverse drug reaction do happen. I have seen resistance when it comes to reporting. Okay, next slide. We need to understand without wasting time, we need to understand the disease burden. I need not, go in detail. The disease burden, across countries and the globe makes the patient obviously to seek a medication. Next slide. So next slide. Even homeopathy also believes in preservation, promotion, and cure of the disease. It is the motto of all the medical system. So to undergo treatment, you have to be very healthy, because apart from your sickness, you have to withstand the medicine. That's a very, very good statement. In Ayurveda, we call the patient-specific parameters beginning from dosha, dhatu, prakriti, the specific temperament, personality type. There are several factors that may influence the response of the medication, a response to a medication, and number one. Number two, a response to the treatment. So one is about the body, the response of body towards the medication. Second, response of medication towards the disease. And this stage, there are several big, including genetic factors, living condition, diet. All of this will make the situation complex. And the best part of pharmacovigilance is to suspect, is to accept. It is not that I need to highlight the thin line between the two. One is about safety and efficacy. Another is safety and the adverse drug reaction or some kind of side effect, some kind of untoward effect. So there is a very thin margin. Whenever it happens, then only we will know. Then the whole purpose of this pharmacovigilance program is to mostly systematically document, and make it available to the scientific community for the future generation. Dear friends, that is the that's why I'm behind, and I always support pharmacovigilance program, because it is not to put somebody behind the dock. It is not to put somebody behind dock. It can happen, adverse drug reaction can happen to anybody who is practicing. Let us not pinpoint our fingers to others that this person has committed a mistake. We need to understand that all the three fingers are pointing towards us, and for the future generation's sake, we have to report a adverse drug reaction. That's all what I want to say. Next slide, please. So all of us know about the adverse drug reaction. That's a part of modern medicine, but it can happen with us also, Ayush system also. I strongly believe there are several ifs and buts and arguments to make believe that Ayush system is 100% safe, which is not true. Certainly, the safety margin is high, but adverse drug reaction do happen, which we have to agree. A practitioner, especially a practitioner, may secretly agree with this, but certainly, certainly, yeah. Yeah, somebody asked a question. That's really good. Next, I'll answer that later. Next. So here this shloka, no drug which is pharmacologically effective is entirely without hazard. The hazard may be insignificant or may be acceptable in relation to the drug's therapeutic action. Furthermore, not all hazards can be known before a drug is marketed. Right? So all drugs are dangerous. Some may also be useful. So the shloka says that visha, like visha, like poison and weapon. No, when they are used, they can be used. They can be really like shastra can be used as a used for surgeries. Similarly, it can also be used for killing. So the second line says tatha aushadam avijnatam vijnatam amritam yatha. Even a person who knows who doesn't know how to use the medicine may end up causing a adverse drug reaction, may end up causing a death, or even the amrita may turn out to be a poison. So the purpose of pharmacovigilance, next slide, is to see and is to suspect. So vigilance is watchfulness in guarding against danger or providing safety. So pharmacovigilance is, again, I'm highlighting the word watchfulness in guarding against danger from drugs, providing safety for the drugs, not for the drugs, safety of the drugs, it is for the patients also. So next slide. So next slide. So pharmacovigilance is the science I want to highlight and the activities. So pharmacovigilance is the science and the activities relating to detection, assessment, understanding, prevention. That is the ultimate goal of adverse drug reaction or any other possible medicine related problem. Next slide. So aims is to improve the patient care and safety. I would highlight patient care and most important is safety, irrespective of systems of medicine, to improve the public health and safety, to contribute to the assessment of benefit, harm, effectiveness, and risk of the medicines, irrespective of system of medicine, including Ayurveda and homeopathy, to promote understanding, education, and clinical training. So, whatever is to first and the foremost, whether it is a physician, whether it's about physicians or the patients or a pharmacist or a nurse or even a ward boy, we need to educate. We need to teach them about being watchfulness. It is, the negative side of whole of this situation is the common belief that is being propagated that Ayurveda is absolutely safe, homeopathy is absolutely safe, no medicine on this earth is safe. Certainly, they would have adverse drug reaction, whether a person would agree at or not. So that's why, in that view, taking that into consideration, Ministry of Ayush has propagated this national program of national pharmacovigilance program for Ayush Siddha, Ayurveda, Siddha Unani, and homeopathy, which is uh, you know which is being run successfully by the ministry through All India Institute of Ayurveda, having more than I think 50 plus, rather 60 plus centers across India, and uh, certainly it will generate. Certainly, I believe that this program is successful, or rather, it is useful to the science, because whenever such adverse drug reaction happen, most of us, and I know 99% to 100% of us panic. We sparingly we get details. Uh, sparingly we get details about Sparingly we get details about adverse drug reaction in the literature. So the National Pharmacovigilance Program is doing a great service to the sciences by recording, trying to generate a signal, and trying to establish possible adverse drug reaction. Next slide, please. Maybe in 10 minutes I'll finish off. Aims of this program is to early detection of until unknown adverse drug reaction and interactions, detection of increases in frequency of known adverse drug reaction, identification of risk factors and possible mechanisms underlying adverse drug reaction, estimation of quantitative aspect of benefit versus risk analysis, and dissemination of information to improve the drug prescribing and regulation. So the ultimate goal of pharmacovigilance are rational and safe use of medical drugs, assessment and communication of risks and benefits of the drugs in the market, educating and informing of the patient. Dear friends, I just want to highlight that it is being watchful. I think for last 10 years, when I was, this program was launched, I was a part of this program from the very beginning. There was a lot of skepticism. There was a lot of skepticism about this program by consistent persistence of the Ministry of Ayush. Certainly, a lot of data has been accumulated. Lot of lot of what do you call concrete data has been accumulated, and I believe that it is something that should have happened about at least 60 years back. So in the last 10 to 12 years, a lot of signal, may not be concrete signal, data has been accumulated. That is the best part of this whole of this program. Number one. Number two, whenever you go to forget about let us keep aside Ayurveda. Let us get into allopathy. Even if you go to allopathy, establishing the cause and effect relationship between a drug and the adverse drug reaction is very, very difficult. So the whole aspect of this pharmacovigilance program, is to be watchful. Number one. Number two, it is to generate some information, concrete information, that by taking this drug or this combination of drug in a specific disease condition or a specific patient prakriti or body type, this can happen. If that is generated, that itself is a great thing. Most of us believe that, I mean, by my statement, that you may think that the whole program is useless, but it is not so. The younger generation, for example, in Ayurveda, we have got something called as bhallataka. The drugs that contain bhallataka, I've forgotten the botanical name. So it will certainly, it is a known drug that's going to cause adverse drug reaction. Whenever it is documented, and published and made known to the, especially the younger generation, it will certainly, it will help in preventing such adverse drug reaction. One is about anticipation, another is about prevention. The whole, the goal or the fruit of this program should reach the patient because patients are the real sufferers. Whether doctor or a pharmacist believes, oh, whether this drug is going to cause adverse drug reaction or adverse event, it is immaterial. The patient should be benefited, because the whole of this program, the fruit of this program should reach the patients also. Next slide. Next slide. There are these are the various stages. I'm not going to go in detail because all of us know this. Even in modern medicine, beginning from whether it is phase 1 or phase 2 or phase 3, and at last the phase 4, that is post marketing survey phase, is all about adverse drug reaction, recording adverse drug reaction very systematically and reporting it to the centers. Next. So basically, whether it is ethics or pharmacovigilance or clinical practice, first do no harm. It is the first do no harm. So whole core of this pharmacovigilance program is to minimize, limit the positive, limit the adverse drug reaction through systematic collection, analysis, signal generation, then dissemination of useful information. Right? So next slide. Whatever may be the whatever may be the type of harm to the patient, beginning from beginning from simple negligible side effect or adverse drug reaction, it may be related to chronic toxicity. Especially, I believe this, there are special groups. In Ayurveda, we call it as Bala, Vruddha, Garbhini, Prasuta, Shalyabhihata, and Rogakrisha. Pediatric, geriatric, pregnant, postpartum, traumatized, patients who are, traumatic condition, and most importantly, chronic illness. The response of the drug in this special category or special group is entirely different. Those who are practitioners do understand this very clearly. I am not able to give examples through, in terms of homeopathy, but those who are senior practitioners, they do understand how the drug acts in this special group. And drug to drug interaction is also possible. So, okay, next. Next. So whole this previous slide, next slide. From pharmacovigilance programs across globe, it is very well known that these adverse drug reaction can be prevented. So you have to anticipate, and you have to anticipate. Then, if you are watchful, then you may, and we are, very well educated about it. You can think about prevention also. This may be a long run goal, but certainly it is useful. Certainly, this program is required for ASU and even homeopathy. Next slide. Ethics is one more aspect of clinical practice and research, both way. So for that sake, pharmacovigilance programs is a must. Right. Next. Next. Here you can see, those who believe that ASU and H drugs are famous, it's very safe. Certainly, for so many reasons. So many reasons, adverse drug reaction do happen. Next slide. So, regulatory need of documenting pharmacovigilance is very much in allopathic, but in Ayurveda, as a part of GMP and GCP, it has not been legally required, but certainly the days are not very far that we need to document. So that's why this pharmacovigilance program is so proactive, so much important. I am pressing too much on this aspect because it is futuristic. This whole program is of pharmacovigilance, is futuristic. Next slide. Next slide. So let us, all of us, believe that we have to report. It is not to sue somebody. It is not to pinpoint somebody's mistake. It is for the future of the science. Okay, from the patient, from health professional, from manufacturer, from authority perspective, you need to report at least pharmacovigilance, this adverse drug reaction and adverse event to the relevant authorities, so that the humanity is benefited. Next slide. Here are certain next. Here are certain terms that most of us should know. I'll highlight on 3 or 4 words, 4 basic terms, which are very frequently come across. The definition of side effect is any unintended effect of a pharmaceutical product occurring at a doses normally used in man, or rather human, which is related to pharmacological properties of the drug. So hope all of us understand what the side effects do really mean. Any unintended effect of a pharmaceutical product occurring at doses normally used in human, which is related to pharmacological properties of the drug. That is called as a side effect. Next page. Whereas the adverse drug reaction is a response to a drug which is noxious and unintended, which occurs at doses normally used in man, rather human, for prophylaxis, diagnosis, or therapeutic purpose for a disease, or for modification of a physiological function. This is a classical definition, which is noxious, which is uh, which is harmful. I need to use the word harmful, and which is unintended. You do not expect it, but still it can happen. So it concerns the response of a patient, in which individual factors may play important role, and the phenomenon is noxious, that is unexpected therapeutic response. For example, from maybe a side effect, but not a adverse drug reaction. So here, the adverse drug reaction is something that you have not heard, we have not expected. It may be exaggeration of its pharmacological action. It may be unexpected pharmacological action. The factor may be patient specific or person specific, maybe of genetic, maybe of some some enzymatic, or maybe some many of the times it happens that you can't you can't make out, but it do happen. There is something called as de-challenging and re-challenging. Through de-challenging and re-challenging, the drug reaction, adverse drug reaction do recur. So I don't want to glamorize this thing, but as a practitioner, most of us know why adverse drug reaction happen, and we have to uh, witness the poisonous, rather harmful effect on the patient, which which many of the times may become unexplainable. Next slide. Unexpected is something unexpected. Okay. Um, an adverse drug reaction, the nature or severity which is not consistent with the domestic labeling or market authorization or expected from characteristics of the drug. It may give an exaggerated reaction, which make it is very difficult to, बहुत मुश्किल हो जाता है कि ये क्यों हुआ है, why it has happened, but it do happen. That is called as unexpected adverse drug reaction. Next important term is a adverse event. Dear friends, say for example in Ayurveda we have something called as ashwagandha, which is used to calm the mind, right? So as an for anxiolytic it is given for insomnia it is given. For example, I have given a medicine and the patient, because of adverse drug reaction, patient may feel drowsy, and that is called as adverse drug reactions. He may get, he may have difficulty in getting up, at 6 o'clock, but he feels sleepy and drowsy. And when he rides the vehicle and he ends up in an accident, right? He ends up in accident. That is called as adverse event or adverse experience. So what it says, any untoward medical occurrence that may present during the treatment with a pharmaceutical product which does not necessarily have a causal relationship with this treatment. So for the beginners, it is an important information that you have given an anxiolytic which induced sleep or rather drowsiness, and you did not expected it, and you did not advise the patient to not to ride the vehicle or handle a machine, and he ended up in some accident, and that is called as a adverse event. The adverse event is not directly due to the medicine, but it is due to the drowsiness or sleepiness that is induced by the drug. So that is called as adverse event. So one is about adverse drug reaction, another is the adverse event. Let me repeat it, and I may end the session. Any untoward medical occurrence that may present during the treatment with a pharmaceutical product, but which does not necessarily have a causal relationship with the treatment, right? The accident is not directly because of the medicine, but it is because of the sleepiness that is induced and drowsiness that is induced, and it could have been prevented by your suggestion that not to ride the vehicle, not to go to a machine, and which may put the patient into a risk of an event that is called as adverse event. Next slide. So serious AE is untoward medical occurrence at any dose that results in serious adverse event, would end up in death, hospitalization, disability, concern, misuse, or dependence. All these come under a serious adverse event. Okay, next. So here is one more term that is very frequently used, is about spontaneous reporting. One more important term, maybe doctor or a pharmacist or a patient can directly report to the pharmacovigilance center. Next slide. Signal is one more frequently used term. Reported information on a possible causal relationship between adverse event and a drug. The relationship being unknown or incompletely documented previously, that is called as signal. When several adverse reaction about particular drug arises, then it makes the pharmacovigilance center to generate a signal through proper procedure. So signal is one more important term. Next slide. Signal is an apparent excess of adverse events associated with the use of the drug. Event a single documented case report may be viewed as a signal. Preclinical findings or experience with other products in the class may be sufficient to generate a signal. A product's risk profile may be characterized by several safety signals. Okay, so signal is one more very frequently used term that you have to remember. Next slide. So next important term that you will come across is causality assessment. Casualty means causality assessment. So it is about establishing the relationship between a drug, causative agent, and the adverse drug reaction. So it is a big thing to happen. So whenever causality assessment is done, and the relationship is established, it may lead to withdrawal of the drug. It may lead to withdrawal of the drug, even at the when it comes to post-marketing survey (PMS), it may lead to withdrawal of the drug. In modern medicine, it is a very common phenomenon. In modern medicine, it is a common phenomenon, but in Ayurveda yoga, Unani, Siddha, and homeopathy, it may take another 2 to 3 decades to specifically, specifically document and bring out with some specific causality assessment so that the drug may be withdrawn. Making a claim is different, but pharmacovigilance is a science. Many of you may, your heart may stir when I say that none of our drugs are safe. It can lead to adverse drug reaction, would make you feel uncomfortable, but that is the truth, and we have to accept that and work towards establishing the truth and to make our science, um, make and establish our science that it is safe to use at the other way also. Next slide. There are several types of adverse events. Next. Type A, B, C. Type A, due to pharmacological effect, fairly common dosage. Next slide. Type B is patient reaction, occurs only in minority of predisposed intolerant patients. Okay, next slide. Type C is chronic and complicated effect. Type D is delayed effect. This is type E is end of the treatment effect. Type F is failure of the therapy. Right? So there are next slide. So I would like to conclude to say that pharmacovigilance. You can go to the last. I would like to conclude that pharmacovigilance is basically about reporting, being watchful. Number one, the word I need to repeat is about being watchful. Number two is detection. Before that, it is about reporting. Please encourage your friends to report adverse drug reaction. Please convince yourself that adverse drug reaction do happen with the Ayush system of medicine. Please convince yourself and convince your fellow colleagues. Please educate your patients that adverse drug reaction happen with Ayush system of medicine. It is not to blaspheme Ayurveda or Ayush system. It is to make the system better through proper reporting, helping the science, and please spread the news that by reporting adverse drug reaction to pharmacovigilance center, they will never be sued. They will never be sued in the court. The document that is generated in the pharmacovigilance program is only for the scientific purpose. Dear friends, please spread this news. I know that people become hyper when they say that they are reporting adverse drug reaction. Please remember that these reports, adverse drug reaction reports, are purely of scientific in nature. They do not have any legal value. So, with this kind request and take-home messages, I thank the Prabhu Kiran sir. I thank Sugatan sir. I thank Madam and all others learned colleagues present over here for giving me this opportunity. And I beg your pardon for delay and extended time. Thank you so much. I'll make a leave.
Thank you, sir, for your valuable session. Sir, there are certain queries.
No problem.
Sir, if the patient is not getting follow-up properly, then how to observe ADFs?
No, when it comes to patient complaints, here what we need to understand about pharmacovigilance is about reporting. We have to just report, right? When we report, when we report, one thing is about the information is being collected. Number two, it is not to sue somebody. It is not to sue, or it is not to pinpoint. It is to suspect. When we are watchful, and report, some signal may be generated. With one case, we cannot establish. Dear friends, we need to understand that with one case, we cannot establish the reaction, the relationship between the drug and the adverse drug reaction. When several information or when several such signals are generated, we can pinpoint it. When the patient complaints is not there, then you have to tell the patient what will happen. That's why it is all about educating. It's a part of good clinical practice that we educate the patient. Despite the best practice, adverse drug reaction do happen. Those who are practitioners really understand what I really mean.
Sir, another question is, are medicine effects completely reversible?
Yeah, that is called as rechallenging and dechallenging. Whenever adverse drug reaction, whenever serious adverse event happen leading to disability or organ damage, it may not be possible, but the adverse drug reaction can be reversed when the drug is withdrawn. Number one, that is called as dechallenging and rechallenging. Certainly, it depends on a specific drug. I don't know on which drug he is telling, but whenever serious adverse event or adverse drug reaction leading to the loss of life, organ failures, organ damage, disability, it is irreversible, absolutely.
Sir, what about antidote to a wrong medicine?
Antidotes are, again, it's, pharmacology is a science where whenever we give antidote, certainly it has to work, right? If it, again, the quality of the medicine, the dosage, and the status of the patient in which we have administered the medicine do really matter. So, antidotes do, good, but when it fails, that is also a part of adverse drug reaction or pharmacovigilance. Dear friends, please understand that pharmacovigilance is not only about adverse drug reaction. We need to understand no effect is also a part of adverse drug, rather pharmacovigilance. When the intended medicine with specific effect, it does not deliver the required effect on the body or property, pharmacological property, that's also adverse drug reaction. That's also pharmacovigilance.
Okay, sir. That's all with the questions.
Thank you so much for the opportunity and remembering me, Sugatan sir, and Prabhu
Thank
Kiran
you,
sir
sir.
and Sadat.
Sir, so Girish sir has spoken about the history of ADRs, and sir also mentioned the quote from the famous Muller about medicine safety. And so what sir was stressing upon is we need to have an open mind, and we should accept the fact that even if a medicine has an action, it can even have an ADR. So even sir mentioned quotes from the Ayurvedic literature where it is mentioned. So medicine can be a two-sided sword. So it can. So sir also gave an example. So of a tool. Tool can be used even for surgery or even for killing. So sir also mentioned about the action of medicines in special groups and the drug-to-drug interactions, which can cause ADRs or which can cause unexpected reactions. Okay, so the main aim of this pharmacovigilance is to systematically document adverse drug reactions and make it available to all. And sir was stressing the fact that it is not to punish anyone, but it is meant to anticipate and prevent such occurrences. Okay, so it was a very valuable session, sir. So
Thank you so
from
much
the
for
side of the
remembering.
Pharmacovigilance Center as well as from management, we thank you, sir. Thank you, sir.
Yeah, I request the madam to share the PowerPoint to everyone.
Yeah, sure, sir.
It's all about practice and spreading the news, making aware about this program, so that the science will be benefited. Thank you so much for the opportunity.
Thank you, sir. Thank you, sir.
Thank you. Bye. I'll make a list, sir.
Okay, sir. Thanks.
Okay, thank you so much, sir, for your valuable expertise you have shared upon pharmacovigilance, its aims, and also what are the various adverse drug events and actions. So
Thank
we
you.
have with us now our next resource person, Dr. N.V. Sugadan. Dr. N.V. Sugadan is a professor of Department of Practice of Medicine in Saratha Krishna Homeopathic Medical College, Kanyakumari, with a teaching experience of 22 years for undergraduate and postgraduate. Sir has experience of being an examiner for various esteemed universities, namely University of Kerala, Kerala University of Health Sciences, Rajiv Gandhi University of Health Sciences, Karnataka, West Bengal University of Health Sciences. Sir was also the member of Board of Studies, the Tamil Nadu Dr. MGR Medical University, Rajiv Gandhi University of Health Sciences, Karnataka. So is also the principal, medical superintendent, and coordinator of Peripheral Pharmacovigilance Center of Sarada Krishna Homeopathic Medical College and Hospital. Sir has served as inspection committee member and member of Board of Examiners, Tamil Nadu Homeopathy Medical Council, Chennai. Sir has various commission experiences as expert committee member in Indian medicine courses and being member of inspection committee, Central Council of Homeopathy. Sir has participated and presented cases in various national and international conferences, seminars, and workshops. Sir has also been awarded as the best volunteer in disaster management service by the Indian Red Cross Society, Kanyakumari District Branch on 11th July 2016. Sir has published articles in various national and international journals. Sir has also published various books, namely Homeopathy for Learning Problems and Homeopathy Arogya Din Nanban, published by Homeopathy, the Friend of Health, Tamil Nadu. Sir will be sharing his presentation on detection and reporting of adverse drug reactions, ADR, and adverse drug events, ADE. Over to you, sir.
Yes, sir. Good morning. I respected Dr. Prabhu Kiran sir, Principal Father Muller Homeopathic Medical College, Dr. Vivek, Coordinator, and Dr. Girish, Vice Principal, Patanjali Ayurveda College, Fatima Saudat, JRF. My topic the detection and reporting of adverse drug reaction and adverse drug event. Pharmacovigilance. Actually, our institution started the peripheral pharmacovigilance in the year 2020. We have been recognized a 9th peripheral center under NIH Kolkata. The duties of the peripheral pharmacovigilance center is to report an adverse drug reaction, report misleading advertisement, conduct awareness programs regarding peripheral pharmacovigilance center and the importance of pharmacovigilance. Pharmacovigilance, the science and activity relating to detection, assessment, understanding and prevention of adverse effect or any other drug related problems. The aim to improve the patient care and safety in relation to the use of medicines, to improve public health and safety in relation to use of medicines, to contribute assessment of benefit, harm, effective and risk of medicine, encouraging their safe and rational use, to promote understanding, education in critical training in pharmacovigilance. The definition adverse event, an untoward medical occurrence may present during the treatment with pharmaceutical product, but which does not necessarily have a causal relationship with this treatment. Adverse drug reaction, ADR, any noxious change which suspected to be due to a drug occurs at doses normally used in man, requires the treatment or disease in dose or indicate the question in future use of same drug. What is ADR and ADE? The ADE, adverse drug event, the AE which happens in a patient taking a drug. Adverse drug reaction, that is ADR, an ADE in which the cause of association is suspected between drug and the event. When drug is developed, it is suspected to act exactly in the target site without any affection or any other site in the body system, but unfortunately this drug could also show the action on the other parts of the body too. Any medicine product which is introduced for desired the therapeutic effect can also give an undesired or adverse effect. ADR is the understand the reaction caused by the medicinal product that occur with administration of single dose or prolonged administration of a drug or two or more drugs. Example, NACID, it is NSAID, it is mainly used for treating fever, pain, inflammation. This would be a therapeutic effect. When it comes to adverse effect, NSAID, which is used for long time, the patient may present with stomach irritation and bleeding. This occurs because besides the action on the desired target, the site, it has also acted on other areas that causes reduced production of the prostaglandin. The function of prostaglandin is to the product to protect the direct digestive system from stomach acid, that is HCl. The reduction of the prostaglandin causes the bleeding and irritation. From this, we can understand the connection between NSAID and bleeding irritation of stomach. NSAID causes ADR to stomach. So we can conclude that the ADR is always related to administered the medicinal products. When it comes to adverse event, any unexpected medicinal occurrence which occurs in a patient or clinical trial subject who has been administered a medicinal product, but this unexpected medicinal occurrence may or may not be the cost due to the administered medicine. Example, a person is taking medicine called a to heal a wound on his knee, and he experienced rashes on his hands during the period of intake of medicine. So here the medicine may or may not be the cause of the rash, but it can be considered for the temporary basis. So we can conclude that adverse event may or may not be related to the administered medicinal product. The classification, already our former presentation explained. There is classification in ADR type A augmented and type B bizarre. These are the traditional classification, and other the type C continuous, type D delayed, type E end of the treatment, type of failure treatment. These are the recent classifications. The type A and B, that is traditional classification. Type A reaction, that is 95%. These are the dose related and result directly from the pharmacological action of the drug, but can be due to drug and drug interactions and drug food interactions. This represents approximately 70 to 80% of all ADRs. Example, withdrawal reaction which may occur after the prolonged use of drug, that is insomnia occurring after prolonged use of hypnotics. Type B reaction, that is 5%. These are the unexpected effects which are unrelated to the non-pharmacological action of the drug. These actions may mainly affect liver, skin, hematopoietic system. Example, drug allergies and hypersensitivity reaction. The characteristics of the ADR, that is the type A reaction and the type B reaction. Normal augmented response, that is under A, and predictable from pharmacology, dose related, reasonably common, rarely fatal. These are comes under the type A reaction. And type B reaction, abnormal bizarre response, unpredictable from pharmacology, not dose related, reasonably uncommon, often causes serious illness or death. The severity of ADR, that is minor, non in need of therapy, antidote and hospitalization. Moderate, requires drug change, specific treatment and hospitalization. Severe, potentially life-threatening, permanent damage and prolonged hospitalization. Lethal, directly or indirectly leads to death. Serious adverse drug reaction, an ADR that at any dose result in death, is life-threatening, requires inpatient hospitalization or prolonged hospitalization, result in persistent or significant disability, result in congenital anomaly or birth defect. The reason for ADR, the dispensing and medication error, the failure to set therapeutic endpoint, bioavailability differences, patient factors, age and sex, multiple disease states. The types of drug prescribed, dosage, formulation, and patient compliance. ADR detection and reporting. ADR detection, the collection of patient data either by patient interview, reviewing prescription containing drugs, obtaining previous medical history, checking for abrupt cessation of any medications. Data to be collected includes the drug therapy details, including over the counter, that is OTC, drugs current medication and medication on administration, details of the suspected adverse drug reaction such as the time of onset and the duration of reaction, nature and severity reaction. The detail of the suspected drug including dose, frequency, time of administration, duration of treatment, and previous report on reported reactions. ADR reporting, what to report? The number one, the serious and life-threatening reactions. Second, fatal reactions. Reaction result in disabilities or permanent harm. The reactions resulted in increased healthcare cost. The severe reactions of any type. New reaction to any drug in the market. Rare and uncommon adverse reactions. Any reaction to newer drugs. This is my presentation. Thank you for hearing.
Thank you, sir. Are there any queries? Somebody has raised hand. Ganesh Gani. Yes, sir. We don't find any queries.
Okay, sir.
Sir, so
Thank you.
sir has defined the ADR and ADE with compact examples. And sir has also classified the ADRs, the different classifications of ADRs. And sir has also mentioned what are the different reasons due to which ADRs can occur. And finally, sir also mentioned how to detect and report ADR. So what are the things that you need to take down or note down in order to make sure that it is an ADR. and how to report that. So thank you, sir.
Okay, sir.
I'm
Thank
sure everyone is
you.
okay, sir. So from the side of our Pharmacovigilance Center as well as from the management, I thank you, sir, for your valuable time. Thank you, sir.
Thank you so much, sir, for your valuable information which you have shared with us. So we have with us our next resource person, that is Dr. Fatima Saudat. Dr. Fatima Saudat has pursued her BHMS from Father Muller Homeopathic Medical College and Hospital, Mangaluru. She is currently working as Junior Research Fellow in Peripheral Pharmacovigilance Center at Father Muller Homeopathic Medical College and Hospital. She has presented research papers in various national conferences, and today, Madam will be speaking on the topic Drug and Magic Remedies, Objectionable Advertisements Act 1954, and its importance to pharmacovigilance. Over to you, Madam.
Yeah, good morning to all. Today, I'll be dealing with these two products. You know what are these two products? Like these are the products launched during COVID time, like Corona time. Advertisements are like really playing a significant role in our daily life. The people were engaged in false advertisement of the various drugs and medical remedies were also advertised without any fear. These two products are advertised during COVID time. You might know that the coronal tablets, if you take that, that will prevent, and this immunobread also. When it was asked for any evidence, they were not able to provide the evidence. Those things are called as misleading advertisements. Okay. So to control such type of false advertisements, central government has been taken certain actions. As a result of it, we have got that Drug and Magic Remedy Act, which came into existence in 1954. This is also recently when I was going through internet. This is a one product I found. If you see the advertisements are claiming that so many diseases will cure. If you see the picture, it is mentioned that all benign tumors are cured. So such as like that only, not only tumors, examples headache, neuralgia, toothache, etc., which may not be possible practically, but most of the conditions mentioned coming under these all misleading advertisement will comes under section 3, that is prohibition of advertisements of certain drugs for treatment of certain diseases and disorders. See, now I'll be talking about the Drug and Magic Remedies, which is Objectionable Advertisement Act 1954. There are some rules and regulations where we are not supposed to follow the things. So the main objective of this act is to control the advertisement of drugs in certain cases, not all the cases, in certain cases. Okay. To prohibit the advertisement for certain purpose of remedies, allowing to possess magic qualities and provide for matters connected therewith. Like there are some medicines, I'll explain to you what all magic treatments are not. So there are some magic qualities, like where we are not able to prove scientifically. These are called as magic remedies. See, the first definition, before knowing to what is misleading advertisement, we should know that what is advertisement. It might, nowadays, all of us know that what is advertisement. Everything is happening in advertisement. So it includes any kind of notice or circular or label, wrapper, any other documents or which we made orally or nowadays where we share through media like WhatsApp, Telegram, Instagram, anywhere. So these all things will come and like these all things are advertisements. Okay. It can be produced in any kind of light, sounds or smoke, that also advertisement. So this is the definition of advertisement. And the second one, what is drug? See, any article intended for use and component of any medicine, substances or article. A medicine for the internal or external use of human being or animals. The any medicine which is given internally or externally to the human being or animals, that is known as drug, or any substances intended to be used for or in the diagnosis, cure, mitigation, treatment or prevention of the diseases in human being or animals is also known as drug. And it any article or other than food which is intended to affect the human normal body functioning of the animals or human being. The both everything is known as drug. As I said in the beginning, there are something called see, for drug we have scientific proof that okay, this medicine will act in this organ or in this human body. But when we come to magic remedy, where we are not able to give the scientific evidence. For example, see, this is I'm telling magic remedy. It can be some people are using traditionally. We are not against that. But there are some things, talisman or mantra or kavacha, anything which is used as treatment or like for the diagnosis of cure or mitigation or treatment of or prevention of any diseases in the human being or animal. So that is known as magic remedy. Please make sure that magic remedy only when it claims to cure the disease or prevent the disease, then it will come under magic remedy, where we supposed to report it. Okay. And then taking part in any publication of any advertisement means, what does it mean? Like, this is not only advertising the publication of any advertisement. If you take part in that publication of advertisement also, you'll be sued. See, for example, printing of the advertisement or publication of any advertisement outside the territory to which it is an act extended by or at the instant of a person residing within the said territory. See, this advertisement, this 1954 Misleading Drug and Magic Remedy Act will apply for Jammu Kashmir, except Jammu Kashmir. All over India, this will apply. Okay. So these definitions will deal with section 2. There are so many sections are there, some 16 sections are there. In that, the second section is under all the definitions. And the third section is prohibited advertisements. The prohibited advertisements, like if the advertisement includes the procurement of miscarriage, or the maintenance or improvement of the capacity of human being for sexual pleasure. We know that there are so many advertisements published in internet or anywhere regarding sexual pleasure as well as menstrual disorders or any kind of prevention. As I said in the beginning, there are two products, coronal tablets are immunized bread. So these all are introduced during COVID time, Corona time, to prevent the disease. So these all things are prohibited. Okay, under section 3, 1954. See, these are the conditions we are not supposed to advertise any, publish any kind of advertisements. For example, there are so many conditions are there in that mainly where we can see in internet about obesity, epilepsy, female genital disorders, cataract, cancer, diabetes. All these are common conditions where we can see the people are publishing the advertisements. Okay. Now coming to section 4, where misleading advertisement related to drugs. First, section 3, we dealt about misleading advertisement related to condition. Now we are dealing with misleading advertisement related to drugs. See, first, section 3, we dealt that this condition will cure, we are not supposed to advertise. But when it comes to section 4, we are publishing advertisement related to drugs, where people will tell that false impression regarding the true character of the drug, where the actual action of the drug is not known, but they just, for the namesake or to improve their company, they give that false impression regarding the true character of the drug. And the second one is make a false claim for the drug, the same thing. otherwise false or misleading to any material particular. The same thing, the medicine action is not known, or they might not able to give the scientific evidence regarding the actions of the drug, but still they advertise without any fear. So these all things, which is really harmful for the patients. Without, if you advertise, if you see advertising any kind of any things, like you guys supposed to report it. Okay, this will create a huge problem to community. So section 5, prohibition of advertisement of certain diseases. See, no person carrying on the profession of administering magic remedies shall take any part in the publication of any advertisement referring to any magic remedy, which directly or indirectly, it might not they might not explain directly that this medicine will cure this thing, magic remedy, this will, if it is claiming indirectly also, we should report it. Okay, this prohibition of advertisement of certain drugs for treatment of certain diseases or disorders to cure the for the diagnosis or to cure or to treatment of or prevention of any disease or disorder, any specified. This is not including all the conditions where there are some I have told, no, some 54 drugs conditions are there. If we see any advertisement regarding these conditions, we should report it. Okay. Then section 6. This is regarding prohibition of import or export. This is nothing but when the medicine is banned in India, so we are importing to India from other countries. So this is also banned, and which is banned in other country, we are not supposed to export also. Then there are some classes of exempted advertisements. Any advertisement related to drugs printed or published by government. This is like something during COVID time, we have got permission to give, if we are homeopaths, we have got permission to give R-Salb, like R-Salb 30 as a preventive medicine. We have got permission to prescribe. So these all things are exempted. We are not supposed to report. An advertisement related to a drug which is sent confidentially in the prescribed manner by the companies to registered medical practitioner. If we get the permission from the government to our clinic or a hospital, then we can publish it. Any kind of leaflets or literature along with packaging of the drug or advertisement of drug in medical, pharmaceutical, scientific and technical journal, or therapeutic index also. Sometimes when you start with the clinic, you will get that therapeutic index or price list, which is published by licensed manufacturer. That is also can be advertised. And any advertisement related to a drug printed or published with the previous sanction of the government, which is already the permission is granted in previous days, that is also can be published. So now coming to what if you don't follow this, like what if you publish this misleading advertisement? For the first conviction, there will be a 6-month imprisonment will be there. Subsequent, if you repeated same thing, there will be 1 year or 1 year 1 year imprisonment with fine. Sometimes it may not be without fine also. So the offenses by the companies. This is like every person who at the time of commission of the offense was in charge and responsible for the conduct of the company business shall be guilty and liable for the punishment. This is in case like a contravention of the provision of the act by a company. However, such person is not liable for the punishment. For example, if a person can give the evidence that he is not involved in advertising the misleading advertisement, then he will be exception, or else they have to pay for it. Okay. This is some examples I can explain to you. Health gadget by Conbio Healthcare. Like Conbio Healthcare was promoting and distributing sunshade to cure from migraine and sunstroke. Okay, they used to give sunshade to cure the migraine and sunstroke, and also for the like socks they used to provide for the acidity, and pillow cover for spondylitis, palm guards for Parkinson's disease, I shade for sinusitis, T shade for high or low blood pressure, shorts pants that cure acidity, prostate and hemorrhoids, piles, urinary problems, bed sheet for paralysis, stroke. So, Consumer Education and Research Society, Ahmedabad, brought to notice of Regulatory Authority, Gujarat, sale and promotion of certain health gadgets by Conibio Healthcare in violation of Drug and Magic Remedy Act. So, when the regulator asked the company to produce the scientific reason to support the effect of that, what all the shades they used to use, and which is claimed to be present in the product, the company said that it had never undertaken such studies in any recognized Indian misleading advertisements and consumer institute. So subsequently, the regulator prohibited the sale and promotion of the product. So if they are not able to give the scientific proof that this medicines or the whatever the content is there in the product will give the result, we are not supposed to advertise. Then one more case study, MD of Kunna Pharmaceutical convicted for the violation of Magic Remedies Act. Through an advertisement, the company was claiming that the product Musli Power Extra, which is formulated for safe musli, chlorophytum borivilianum was used, known as Indian herbal stimulant, could treat infertility in both men as well as women. In September 2009, the company had given advertisement in a leading magazine violating the provisions of the Act. The advertisement stated that the product cured infertility by enhancing sexual capability and fertility. The drug inspector argued in the court that the advertisement was in the contravention of the provision of Section 3 that, as I said in the beginning, we are not supposed to advertise any related to female sexual organs or male sexual organs, and was in the contraventions of provision Section 3 and of the Act, and item number 48 of the schedule of the Act about the violation of the case. Drug Inspector John said Musli Power Extra manufactured by Kunna Pharmaceutical is a good Ayurvedic product, but the case was taken for giving publicity violating the MRO Act. Okay. The court has imposed a penalty of 50,000 and also imposed a jail sentence for 4 months on the owner, proprietor, okay, Abraham. And this is regarding, as I said in the beginning, magic remedy. Action against Nirmala Baba, self-styled Baba from Punjab, who advertised, who was famous in giving magic treatment to the patients. So, action against Nirmala Baba, a self-styled Baba who advertised offering magic treatment to the patients. The division bench of the acting Chief Justice A.K. Sikri and Justice R.S. Edlow sought response from the government by and asked petitioner A.K. Jain to make city-based Nirmala Baba a party in the case. When they have asked for the scientific proof that this Musli Power Nirmala Baba was giving treatment regarding, so they were like, they're not able to give the scientific proof that this medicine will cure this particular disease. So in that case, anything in here also, like in India also, so many magic remedy treatment are going on. So if we see anything, this is not something we are going against them, but this is actually illegal. So we have to report it. So everything, like I've told, you have to report. The some might be having the question that who can report and where I can report. So who can report? This is anybody can report, not only health professionals, doctors, or anybody can. If a person is walking, if a person is going through social media, if we find anything, if we feel that okay, this is not mentioned or this is against the Magic Remedy Act, then you can report it. So where to report? The next question will be where to report. The report reporting on prescribed format can be submitted to the nearby Pharmacovigilance Center. If you are from Dakshina Kannada, you can report it to Father Muller, or you can report it to directly to Delhi or you can report it to this direct website is there mentioned. If you want, you can take it down. www.ayushsuraksha.com. You can directly report it to them. You will get a form. You'll get a format. You can fill that and you can submit it to them. Or else you can directly call to this number if you want to report it anything. Yeah, thank you. Yeah, there is a adverse effect of drugs seen in the patient may not be the same for others. So how to conclude that? Okay, that is regarding ADR. Dr. Vivek sir will explain to that. Yeah, thank you.
So, thank you, Dr. Saudat. There was a query. Why sorry. Okay, so the adverse effects of drugs in patient may not be the same for others. So how to conclude that these are adverse effects of the drug prescribed? So for that we have something called as a Naranjo's criteria. Naranjo's criteria, it is put up in the chat box. So we have something called as Naranjo's criteria. It is a set of questions. So we'll be answering to those set of questions, and by doing that, we'll come to know whether that particular effect is caused by that particular drug or not. Okay, so by doing that, we'll be able to check whether that action is related with that particular drug. Okay. By filling a complaint, by how many days action will be taken? So it again depends on the type of the advertisement, and many a times the action will be very quick. So if you see the examples, whatever she has shown, the coronal tablet as well as the immunobread, all those things were immediately banned. So for some of the things, they'll be conducting an inquiry, and then they'll be banning the product or the advertisement. Are there any queries? Okay, why adverse effects of drugs are not recorded during drug proving? So during drug proving, we are actually recording the physiological or pathogenicity of the drugs. Okay, so these adverse drug reactions mostly occur during the treatment phases, treatment of the cases, or when we give a medicine during the drug proving, we usually give it in a very minute dose that it doesn't go into a toxicological or more pathological levels. Okay, so by the in the session of misleading advertisements, Dr. Saudat mentioned about what is an advertisement and what do you mean by publication of an advertisement, and she even showed a list of conditions, list of disease conditions for which the advertisements are banned. So if you had gone through those lists, it contains a number of commonly listed conditions for which we very commonly used to see the advertisements. So even including fever or for weight reduction, all those things are there. So, but we are not aware that the advertisement should not be given for such conditions. So that is the reason why such advertisements are still continuing. So now, at least after this session, we hope that you will be able to identify which are the misleading advertisements and you will be able to report it. Okay, and she also said that misleading advertisement is not only related with products but also related with drugs. Okay, so certain drugs which gives a false claim also can be reported. And she also gave real life cases where a number of advertisements were floated by a number of companies, and someone had reported that, and queries were sent by the authorities to the company, and uh, seeing it as a false claim, it got banned. Okay, so what we aimed at today's session is to give insight into what is pharmacovigilance that is related with Ayush system. This concept of pharmacovigilance is there in the modern medicine since a long time, but in the system of Ayush, it is a new initiative. So this webinar was aimed to give an insight of what do you mean by pharmacovigilance, and what is the need for pharmacovigilance in the system of Ayush. And we hope we have done our best. Okay, over to Dr. Meban.
Yes, thank you so much, Dr. Saudat, for that informative session upon reporting and all the advertisement, misleading advertisement, and giving us some more insight into the subject. Now I invite Dr. Vivek Sakthidaran, coordinator of Peripheral Pharmacovigilance Center, Father Muller Homeopathic Medical College, to deliver the vote of thanks.
So progress is impossible without a change, and those who cannot change, their minds cannot change anything. This is a word said by George Bernard Shaw, the great Irish playwright. This quote stands apt for our program because even with the Ayush systems of medicine, which were considered completely safe, there have been reports of ADRs which could be attributed either due to poor quality product or improper use of medicines. Further, when Ayush medicines are used in conjunction with other medicines, there is a possibility of drug interactions. So, considering the growing use of Ayush products and medicines globally, the inclusion of traditional medicines in pharmacovigilance became equally important. And thus, the pharmacovigilance program for Ayush drugs was initiated by the Ministry of Ayush. As a part of it, here we are a group of around 200 enthusiasts joined together to gain knowledge about the safer use of Ayush drugs. First and foremost, I offer thanks to the Almighty for bestowing upon us the blessings to conduct this event. I thank the Ministry of Ayush for the initiation of pharmacovigilance scheme for the safer use of Ayush systems and for providing the funds. I thank our management, Administrator Reverend Father Roshan Krasta in his absentia for providing us the required infrastructure and the facilities. I thank our Principal Dr. ESJ Prabhukiran and Vice Principal Dr. Vilma Mira D'Souza in their absence for guiding the organizing team with meticulous planning. This event was made possible by the great sharing readiness of our resource persons who wholeheartedly accepted our invitation. On behalf of the management and the entire organizing team and the delegates, I thank our resource persons for the day, Dr. Girish KJ, Dr. NV Sugadan, and Dr. Fatima Saudar. Thank you, doctors. I thank the principals, vice principals, interns coordinator, and PG coordinators, and the staff of various colleges for encouraging their staff and students to join this webinar. Thank you all. For organizing this event, I was backed up by a team of doctors who were active in the publicity of this webinar. Along with thanking them, I also thank each and everyone who helped in sharing the information regarding this webinar. Thank you all. I thank our MC for the day, Dr. Meban. Most of all, a wholehearted thanks to all the delegates of today's webinar, which includes teaching faculty, medical officers, interns, and postgraduates from various medical colleges, private and government medical practitioners all over India, And we have with us the program coordinators and JRFs from various pharmacovigilance centers and research officers from different institutions. And I need to specially mention that the delegates are not only from homeopathy, but from every other Ayush stream, which includes Ayurveda, Unani, and Siddha. A big thanks to each and everyone. This enthusiasm and spirit shown by the delegates is what keeps us going. I'm sure everyone will be greatly benefited by this webinar in learning the concept of pharmacovigilance and how to apply it in your practice. Thanking everyone once again. Thank you all.
Thank you, sir. Dear delegates, we will be sharing the link for the feedback in your registered email ID. So you will be receiving the participation e-certificates in your respective email after successful submission of the feedback. Please make sure that you provide the correct email ID because any mistake will lead to failure in sending the e-certificates. Okay? So we hope that you have all been benefited from this session conducted by the uh, Peripheral Pharmacovigilance committee members led by Dr. Vivek Sridharan and his team. And we hope that you will use this knowledge in your clinical practice and also in your research practice for how to use the Ayush medicine effectively. Myself, Dr. Mevan Kuntingan Rani, signing off. Thank you